Hi, I'm Monique from the Bedford Police Department, and with me is Police Chief John Bryfonski and Fire Chief Scott Hunter. We want to update our community because with COVID-19, things are constantly changing, so we just want to let everyone know what's changing here on our end. Hello, gentlemen.
Good morning.
Hi, Monique. How are you?
I'm wonderful, and you?
Great.
Excellent. All right, so how do you feel with everything changing? How do you feel your department is adapting to these minute-by-minute changes?
I'd say that we are getting new policies in place every day. We create a policy that can adapt and change with this, and we're updating that at least on a weekly basis, if not on a daily basis, based on the consistent changes. We've worked hard to get ready for a surge. We don't know what a surge looks like in our community or when that might happen, but we know that we would need some personal protective equipment, and we're making sure that we have what we need for that time. And there's been some challenges in getting that, but I've started to feel some relief in the last week. So feeling more and more confident that we're going to be ready in the case that that should happen.
So the police department is pretty much the same, Monique. We've instituted a number of changes in policies. Who would have thought that police officers, firefighters would be taking their temperature every day before they come into the safety complex, right? A number of policies and changes, unlike the fire department. We've changed how we handle certain calls. If a call doesn't require an in-person response, then the individual is likely to hear from a police officer on the telephone. And of course, if we need to send a police officer, we certainly will. But our lower priority calls are now being handled mostly by telephone, social distancing, meeting people outside. Of course, the safety complex is closed to visitors, but of course, the outer lobby is certainly always open for people who need the police department, police officers, or the fire department. The drug drop box is still in the lobby. That's available. But a lot of changes, as the fire chief indicated, we're looking at various ways to protect the community and making sure that the police officers and firefighters are protected, because if they're not well, then they can't protect the community.
Absolutely. Now, we mentioned things, it seems like information is coming at us every minute and people are getting information from all different sources. And one of the big sources of confusion is the stay-at-home order. And I've heard people wondering, are they going to get in trouble if they leave their homes? Could you elaborate a little bit on that, please?
Sure, Monique. Nobody's going to get in trouble for leaving their house. The stay-at-home order is advice and guidance that the governor, the national government, the federal government, and all of us, police and fire, are guiding people to stay at home and isolate as much as they can, creating social distance. Police officers are not stopping people because they're on the road. There are a variety of essential businesses that are still open. We know folks need to go to the grocery store. They need to go to the pharmacy. They need to get gas for their vehicles. A lot of folks are still working. There's a lot of folks, the brave folks that are working in the grocery stores every single day, stocking shelves and cashing out. All those folks are working. The truckers, all those folks are working. Healthcare workers, certainly there's just a whole host of people that are still out there working. So we're not stocking cars. Stay at home means that if you're not working, and if you don't have to go out, then stay at home. Maintain social distancing, minimize contacts as much as you can. There's been questions about whether or not we're stopping people with out-of-state plates. The borders of New Hampshire are not closed. We're not stopping cars with out-of-state plates. Of course, being close to Massachusetts, there's always a lot of vehicles with Mass plates here in our community anyway. But no, we're not stopping vehicles. Stay at home means it's good practice while this pandemic is reaching the apex of the curve, so to speak, to try to limit the amount of contacts that people have, because social distancing is proven to be the best preventative action that we can all take.
And with social distancing, something we're trying to do right now, trying to stay apart from each other, what else can people do to help flatten the curve?
There's no question. And the advice that's been given right along since the beginning of this has been to continue to wash hands, the social distancing aspects of this, and it's working. We have already flattened the curve. The advice is really simple, but that doesn't mean it's easy. It's hard, and it will become harder as time goes forward, the longer that we do this. And it's a marathon, not a sprint. We need to go for the long haul. So people staying at home and taking care of their mental health, taking care of their family's health at home, and finding new innovative things to do at home. And we're trying to do our part with that as well, through social media and those types of things, and trying to help families out with that. But from what I've seen, especially in social media, the people of Bedford and the Bedford community are coming up with some great innovative ways to help each other and to be able to also keep these things in mind and practice these.
Now, if someone does have an emergency, what should they be aware of when they call 911?
That's a great question. And so we're doing the best that we can to protect our providers. We want people to call 911 when they have a medical emergency. That is still the right thing to do. Call 911. What you should be prepared for is you always ask a series of questions when you call 911 in case of a medical emergency. However, in this case, you may be asked a different series of questions, like, do you have flu-like symptoms? Or anyone in your home have flu-like symptoms? And that goes for police and fire calls as well. We need good, honest answers to that. Doesn't mean that we're not coming. We are coming if you call 911. It means that our response to that changes in the types of protective equipment that we're going to wear in order to protect ourselves and to protect you. So that's the only thing that changes, by being honest with us and giving us that information. And I know that there's been some changes on the PD side as well.
Absolutely, Chief. When you call for a police officer, if it's not a 911 call, our communications folks will ask if there's any sick folks there, or if the caller, him or herself, is sick or has flu-like symptoms. And again, as the chief indicated, that's to make sure that the officers, if they do have to make an in-person response, can prepare ahead of time by wearing appropriate protective equipment to protect them. And again, they are going to have contact with other folks during the rest of their shift, just like firefighters and EMS folks do. And of course, we don't want to spread the disease and virus to other folks because we come in contact with other folks that are unprotected. So they will be asked a series of questions, but as the chief indicated, if you need a police officer will be there, even for a low priority call, even though it may generally, we might request that it be handled by telephone, but if you need to see a police officer will come and respond. But again, we're asking for good, honest answers. We're going to come, but we need the good, honest answers so that we can get prepared ahead of time.
So we don't want the public to be afraid.
Absolutely.
All right.
Correct.
Now, Chief Hunter, you had mentioned the surge, and that's something that they're saying, expect for this surge. What are we doing to prepare for it?
Sure. So there's several plans in place. We're working with our area hospitals to have good plans in place. We're also looking to protect our providers, our medical providers, who are also our firefighters in our community, and to make sure that they stay healthy in the time leading up to that. Also, as I mentioned before, a collection of PPE, which I've started to feel some relief on, and I'm extremely proud of our businesses and residents. We've gotten some donated materials, such as N95 masks that have been exactly the things that we need. So those things have been very helpful, but I think that I think our community businesses are starting to step up and provide some of that help as well.
Chief, did you have anything to add?
The community has been just outstanding. There's not a day that goes by that we don't have sometimes anonymous gifts that are left at the police station, whether they're handy wipes, hand sanitizer. We've gotten several cases of hand sanitizer donated. We've gotten cases of handy wipes, and we are burning through handy wipes. There's constant wiping down of the cruisers, the interior of the cruisers, the shared equipment, that the police officers use, the shared computer equipment, the MDTs. All these things are cleaned constantly right now. So the donations from the community have been warmly received. And again, it's just evidence of how great Bedford really is and how much they care for their first responders, police, fire, and EMS. And we post a lot of those photos with your help on our Facebook page, recognizing as much as we can. And of course, we have a group in town, Bedford Cares, 792-1319. That's set up and organized by Town Councilor Denise Ricciardi. She's gotten now over 100 volunteers to help deliver food pantry, help folks that are should be going out because of their age or because they may have compromised immune systems or physical disabilities that make them particularly susceptible to the virus, that those volunteers will pick up their food, their medicines, go to the pharmacy for them. And again, all you need to do is call 792-1319, 792-1319, or on Facebook, it's Bedford NH Cares. Again, that's Denise Ricciardi, and her army of volunteers are out there helping Bedford stay well and stay safe.
That's excellent. And I just have to add, I feel overwhelmed by how incredible the community of Bedford is, how much they've been stepping up to not only help the police, fire department, to help the town, but to help each other. And that's just another wonderful example of how much this community cares. So on that note, what would you gentlemen like to say to our community?
Simply that I'm extremely proud of the response. And that's what we want to be able to say all the way through this. At the end of the crisis, we want to be able to look back and say that we were proud of our response, not just as a fire department or a police department, but also as a town and as a community. And thus far, I can say that. And I'm very proud of the community for doing what they need to do. I've often said that we're not necessarily always the first responders. People in the community are the first responders. In this case, where we're trying to reduce the risk, we reduce risk every day at the fire department, but we can't do it without our partners in the community. And in this case, everyone staying at home is doing that. Also, the folks working here at the fire department and everyone that's working in the town, and including our building officials that are part of the fire department, are doing a fabulous job. The sense of responsibility that I can feel, it's tangible, from folks that work here with us, has been incredible throughout this. And in some cases, it's difficult to ask them to work from home because they want to be here and they want to be helping. So whereas our first responders might not be able to do that, others can, and that's helpful too. So I'm just overwhelmed by the sense of responsibility the folks that are working for the community have. Thank you.
Chief Bryfonski.
I'd like to tell the folks and residents out there, first, thank you for all the support that you've given all the first responders. But I particularly want to emphasize that we will get through this. We faced challenges and adversity in the past. America has always risen to and above and succeeded, and we will do that now. This is a sightless, faceless, insidious enemy, one that we've never faced before in this country for more than 102 years. And we will overcome this enemy. We have methods and ways to fight it. We are providing all of you with the information as we get it so that you can help flatten the curve, as they say. The federal government and the scientists and the epidemiologists are working feverishly to develop drugs and vaccines to eradicate this enemy from the shores of America, and we will overcome. But it's going to be a while. We have to hunker down and steel ourselves for several more weeks and maybe even longer to be able to get through this. But we will pull through in great fashion. It takes a community to be a community. We have a great community. We can all pull together. We can all help each other, and we will overcome this disease.
Thank you, Chief. So like you just said, we're in this together. We'll get through it together. Gentlemen, I want to thank you both so much for taking your time to talk to everyone today.
Thanks, Monique.
Thank you.
Thank
Thanks.
you.